Hello all, my name is Shauna and I have something, I had something called SVT, supraventricular tachycardia, which is fancy talk for fast heart rate. I just underwent a procedure to have it fixed, and hopefully it will be completely successful. So far, so good. It has been about about 28 hours or so since I had the procedure done. And I am at the conclusion that I believe that anybody who has SVT and it's affecting your life in any kind of way, socially debilitating in any form or capacity, should definitely have this done should you have access to insurance. It's not a life-threatening condition, but it is definitely a limiting factor for anyone who has this, the SVT, because it can happen depending on you, on exactly how your heart is mapped out with what is causing it exactly. Mine was an extra AV node. You have an SA node and an AV node in your heart, 4 chambers. In the upper right portion of your chamber, there is an electrical signal that is sent, which tells the rest of your heart to beat. Just like any muscle, like your brain sends a signal and it sends an electrical pulse type thing to that muscle to move around and do whatever. And so the heart works just like any other muscle, and it's actually, the muscles in the heart are very similar to like skeletal type muscles, but it is not actually connected to the brain. It's actually connected more like the nervous system. And that is all technical talk, but I will go back to the fact that my name is Shauna, and I have had SVT for 28 years now. The first time it showed up, I was 13 years old. I was walking to school with my brother, and he was a bit freaked out when I hit the ground and grabbed my heart and said, "Oh, my heart." And he ran home, got my parents, came back, picked me up. We went to the hospital. I was misdiagnosed, which is something that happens frequently with this, especially when you're a bit older. I am 41 now, and back then they didn't really know what it was, and didn't know how to fix it at the time. And so I've gone for quite a long time having this issue and not having a fix for it. A lot of technology has changed since then. I mean, we didn't even have cell phones back then, so it's a little embarrassing, but fact of life. So I learned just through the course of time to bear down. It's kind of funny how the body works. You sometimes do things naturally to fix things, and I just held my breath and I would bear down, kind of like if you needed to go poo or giving birth or any kind of thing that they tell you to push really hard. So I knew how to really get down deep into my core and make it, stop. And it would, I didn't know that it was called a vagal basal maneuver. And I also learned that, and it may have been kind of subconsciously done as far as realizing what was causing it, as far as my activities were concerned, I would go and do stuff like work on the yard, or if we had like a social day, sometimes during the social things I would have issues and I tried to hide it. But sometimes you just can't. It's too much. My magic number was always 220. 220 beats per minute. And when I was young and fit, it didn't hurt. It was just more of kind of an anxious thing, and I would bear down and I'd get it to convert back, no problem. It's kind of like learning how to cure your own hiccups in a way, I guess. I know how to cure my own hiccups. It's just you find what works for you and you do it. And so having gone through this, getting ready to have the procedure done after I found out that the person I needed to see was an electrophysiologist, an EP, electrophysiologist. Electrophysiologist being Physiologist, just for anyone, kind of SVT for dummies. Because I didn't realize, I thought I needed to see a cardiologist. Cardiologists, no offense to other doctors out there, but it almost always seems like a doctor wants it to be their problem. They want to fix it. So it's almost like, this is my baby kind of thing. And it's not. Some things are just not in that area. This is more about the electronic part of your heart, so to speak. Not that it's a machine. It is, but, biological it may be, it is still a machine, and it still works in a certain way, and it works with electrical pathways. And that is where SVT comes in. You have an SA node, which is where the electrical current starts. It shoots down into your heart and hits your AV node, which controls the way the bottom two chambers of your heart pump or contract. And my AV nodes were very close together, so when the SA node sent its signal down, it was just doing a tight little fast little circle, and that is what was causing me to have such a high heart rate. For those of you who are looking at having this fixed through catheter ablation in your heart, please don't worry. You are going to be fine. I obviously, don't sue me or something if I'm not a doctor. I'm not licensed in any way. I'm a patient, and I'm just giving you my personal experience. And on that note, my personal experience it was fantastic. I would definitely, if it is an option, and for some reason this wasn't the fix that I needed right away, I have another episode, which I really hope not, please God. Let this be the last time I ever have to deal with that. It is something that I believe that I would, should it be an option for me, go through and do it again, because it was easier than going and getting a tooth pulled, and I am deathly afraid of dentists. I don't know why. It's a nerve thing, I guess. But this doesn't have anything to do with that. You go through local anesthesia, not general anesthesia, because they need to be able to bring you up out of it if they need to. If they can't get the SVT to trigger, they may need to bring you up a little bit and then do it. Because if you are too out of it, then your SVT may not occur. Your heart is too relaxed, and it's just so beating. And they need to really get it going so they have your heart beating. They are mapping that out. They see where the focal point is for your AV node that works for you on a regular basis, and then they trigger the tachycardia. And when they do that, they see the other one. Suddenly the other one appears, the extra AV node, or whatever it is that's causing it. I think that for most people it is just an extra AV node. Like I said, I'm not a doctor. So they focal point on that. and then they go and burn that sucker. Well, mine being so close to one another, he burned as much as he could, about 19 times, which is, from what I understand, several times. And when I woke up, because I didn't wake through the entire procedure, I went to sleep, and I woke up and they said it was successful. And then I cried happy tears, because it's really hard going through so many years of social anxiety and having it really affect your life. 28 years I've been dealing with it, and it's awful when it becomes that painful, and I can't go to my son's graduation because I have to go to the emergency room in the middle of it. It's not fun. It's not fun at all. And I wish I had known about this sooner, because I would have gone sooner and had it done a few years ago if I could. But it had just gotten to a point where it was out of control. I couldn't get a vagal vasal maneuver to respond, and I was unable to stop it, and I didn't feel like I had any control over it. I felt like I was going to pass out. I was in the emergency room at least once a month, and this last year has been a roller coaster of trauma due to it. And my family trying to figure out what to do with the kids in the middle of the night, because it seemed like most of the time it would hit during those times, as if I had physical exertion during the day and I would relax, and then suddenly boom. So when you're getting ready for important events and the like, and also being afraid of like flying or something, because what if something happened while you were in the air? You would have to wait it out, but I think, that's a whole different story. But if any of you are out there who are worried about this procedure, honestly, it is very easy. The hardest parts are the fasting, which, that's a piece of cake, really. And since it was local anesthesia and I told them I was really thirsty, they let me have some ice chips even before the procedure, which didn't affect me in any kind of way. And then there is having the fact that they go through, well, it depends on your doctor. With mine, he went through my femoral arteries, both of them. And so I had, these cotton ball things with tape there in the groin area. And I was warned, you can't lift anything for over 10 pounds or up to 10 pounds or whatever. And, and if you have to cough or sneeze, or should you have to vomit, to hold on to those areas, apply pressure so that it doesn't cause trauma and bleeding, because that is a 911. Should your femoral artery, that's not good. That's an artery, so you don't want to bleed out. But that is also very unlikely. It's just a little uncomfortable. I've got a bruise on one side and the other side looks really good. But that's the worst of it. I mean, honestly, it sounds really scary because it's your heart. What if yourself to death, because it's not worth it. It's really not. I did it to myself. I became a nervous Nelly. I was scared to death, but the good outweighed the bad in my case, and even though I was scared to death, even though I didn't really know what to expect, I went on YouTube, I looked around, and I found some people who had talked about their experience. The fact that they said that they woke up through part of it or were awake through the whole thing, some of those things, okay, that would have been freaky to me if I didn't know about it. Since I knew about it, not a problem. I'm okay with that. I'm okay with watching. But that wasn't the case for me. I was asleep, and they woke me up after, said it was done, and it was a success, and I couldn't be happier. So I have to stay on the beta blockers for another 30 days. I will see my doctor, I think, in like a week or so, and then I believe I'm able to come off of the beta blockers because they won't be needed anymore. And I hope and pray that this doesn't happen again, because if I had to toss a coin, heads you have to have it again, tails you don't, I would wish for tails. Just because it's, another medical procedure, and anytime you have any kind of medical procedure, there's always a risk involved, however minute. And I would just, I would like to go the rest of my life without having to worry about this again. So yeah, if you have any questions, feel free to ask, and I will answer them as well as I can. If I am unable to, I will still answer you, but I will refer you somewhere that is a better option for you. But like I said, it's an electrophysiologist. That's who you need to talk to your doctor about. If you have a fast heart rate suddenly that just boom hits you and it's happening and you don't know what to do, bear down. Use your vasal maneuvers. VEGAL. Oh, vasal. I don't know. I'll write it down in the comments. And just work with it and get a referral. Go see an electrophysiologist. They'll send you to a cardiologist in all likelihood, and then the cardiologist will get you with an electrophysiologist, and they will work with you from there. I had something called AliveCor, ALIVECOR, and that was an app I put on my smartphone, and it's a little doodad, a little electrical or rectangular piece of plastic that has these two metal electrode type things on them. They're not like sticky or anything. You just stick your fingers, but you place your fingers on them, and it takes your heart rate through your fingers. You can also use the top of your knee and your fingers, and that's actually how I was officially diagnosed, and where he was able to say that he figured out where my SVT was coming from, and that when I finished, it was where they thought it was, and everything was very smooth. So yeah, I highly recommend this to any of you out there. Please don't worry, and just know that, if you feel comfortable with your doctor and they are competent, you feel comfortable with them, and I say go for it. I mean, you certainly have nothing to lose at that point, and it's really not that, with technology these days, it's great. It's wonderful. And going from a time when they were inventing, putting faxes in places when I was younger in school, and going to having cell phones, and then going to having, iPads, and all these different wonderful things. Technology can really be a friend. And I know we've all gotten in a real hurry, but this is one thing that I can say I am extremely grateful for technology and helping me in this situation. So, again, my name is Shauna, and do feel free to post any comments, questions, remarks, whatever. Please be nice, and I will be as helpful as I possibly can. You guys take care.